Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. Today we're going to talk about lung cancer, the leading cause of cancer deaths on Long Island and throughout the United States. In an effort to end lung cancer, the American Lung Association launched its first ever Lung Force Walk Long Island at Eisenhower Park this past October. My guests today are Michael Seilback, the National Assistant Vice President of State Public Policy for the American Lung Association, and Nicole Sturiano, a resident of Ridge here on Long Island, who lost her sister Jeanine to lung cancer at 42 years old. Michael and Nicole, welcome to Your Family's Health on the Voice of Nassau Community College, 90.3 WHPC. Welcome.
Thank you. Thank you.
Welcome to you both.
Thanks so much.
So first to Nicole, I'm just so sorry to hear about your sister Jeanine and your loss. So can you tell me more about your sister Jeanine and just how she was diagnosed and just her entire story?
So my sister had a cough. It was November of 2013. She had a cough. It just wouldn't go away. She went to the doctor and was diagnosed with stage 4 lung cancer. She never smoked a day in her life. We were shocked. From there, she was put on a targeted therapy. She was on that for about a year and then switched to another one, and that stopped working after 3 months. And she started conventional chemotherapy, stopped working, went to a clinical trial, and then we were at the end of the road.
I'm so sorry to hear that. So what are some of the things you do to keep her memory going?
Well, first and foremost, I continue to support and stay involved with Lung Force. My sister initially started our team back in 2015. She spoke at the first Lung Force walk in New York City. And so I continue to do that in her honor. I also started a college scholarship fund in her memory through her high school. I had a plaque placed in memory at the Norman J. Levy Park in Merrick. It was the park that we used to go to and just walk. It's very peaceful. And I talk about her every day. I tell her story, and I try to raise awareness so that other people do not have to go through what we did.
Wow. So where was Jeanine in your family? Was she the oldest or the youngest?
The oldest. There's 3. It was Jeanine, myself, and I have a younger brother, Christian. So Jeanine was the oldest, and she just was an amazing person.
I can imagine. So Michael, tell us about the American Lung Association and what it does.
Sure. So the American Lung Association is the nation's oldest public health association. We've doing work on improving lung health for almost 120 years. And clearly, lung cancer is an important part of that mission. So we do education and awareness about all different lung diseases, from lung cancer to asthma, COPD. And we focus our efforts on research, education, and advocacy to try to ensure that people are living longer, healthier lives.
So going back to Jeanine, can you tell me what were some of her symptoms that presented, more towards before she was staged?
She had back pain for a while, but she saw a chiropractor for that. And whatever testing they did not show any tumors or anything. Then she developed the cough, and the cough got so bad where when she would cough, she wouldn't be able to catch her breath. And that's what took her to, to go to the doctor to try to get that under control.
And that's what brought her to her primary care provider, that
Right.
cough. So,
And they took a chest x-ray and
yeah,
it wasn't, they could almost immediately see it.
they almost immediately saw it. So, Michael, why is a lung cancer awareness so important here?
So the story Nicole tells about her sister, unfortunately, is somewhat common. Lung cancer is often found in later stages because the symptoms that Nicole talked about, sort of a strange back pain and a cough. For most of us, that's a random Wednesday, right? So unfortunately, those are symptoms that it doesn't present in the same way that a lump or a strange looking mass might. And so it's really important that now there are new diagnostic tools, and lung cancer screening is something that is important for some people, and so we want to raise awareness about lung cancer screening, but it's also important to realize that lung cancer screening would not have been eligible for Jeanine either. And so there still is a long way to go for people that are generally presenting as healthy, are not someone who is exposed to some of the carcinogens that we know are a major cause of lung cancer. So there's really sort of two messages here. One is for those folks that are eligible for lung cancer screening because they are at high risk, we want folks to talk to their doctors. And those are people that are between the ages of 55 and 80 years old and have what's called a 20-pack year history of smoking, which means that perhaps for 20 years they smoked a pack a day, or for even 10 years they smoked 2 packs a day. That is someone, if you're in that age range, that you should talk to your doctor, because lung cancer screening might be something that's eligible for you. And this, pretty easy CT scan detects tumors at a very early stage before those symptoms are presenting themselves, and there leads a lot more options for treatment in those cases. On the other side of the conversation, when we think about Jeanine's story and sort of others like her, we need more research into lung cancer. We need to know why people that are not someone that we would expect to have lung cancer, what are some of those things that might lead to them developing lung cancer? We know that the fact is, if you have lungs, you can get lung cancer. And so what that basically tells us is anyone can get lung cancer. And there, for far too long, has been a stigma associated with lung cancer. And we're trying to remove that stigma and treat lung cancer like any other disease, that it doesn't matter why you got it. We need to make sure that people are living longer, healthier lives after diagnosis, and that we have an army of lung cancer survivors with us to fight this disease.
So you recently released a report called The State of Lung Cancer. How prevalent is lung cancer in the state of New York?
So, lung cancer remains the leading cause of death of all cancers. And, it continues to be, a major, threat. New York, compared to other states, is actually doing, very well. The 5-year survival rate is in New York is among the top in the nation. Our early diagnosis rate for lung cancer is among the top in the nation. But that the screening rate has a long way to go. New York is sort of average when you look at states for our eligible people getting screened for lung cancer. And it's important to recognize that even states that are, doing the best in our report, only 11% of eligible people are getting screened in the states that are doing the best. In New York, that rate is down, almost at 5%. Only 5% of eligible people are receiving screening for lung cancer, and we want to see those numbers drastically improve, because we know that as screening increases, we're going to see lives saved.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today you are learning about lung cancer, the leading cause of cancer deaths on Long Island and throughout the United States. My guests today are Michael Seilback, the National Assistant Vice President of State Public Policy for the American Lung Association, and Nicole Sturiano, a resident of Ridge here on Long Island, who lost her sister Jeanine to lung cancer at 42 years old. After listening to this story, is there anything that we can do to prevent lung cancer, to catch it early?
Absolutely. There are things that we all could do. We want to minimize exposure to what we know put people at higher risk. So the leading cause, one of the main reasons that people contract lung cancer is exposure to tobacco smoke. So if you are a current tobacco user, now is the time to quit. We are coming up on the new year. And so folks should make their plan and look to look to quit that addiction if possible, starting in the new year. There are other exposures, however. The second leading cause of lung cancer is from radon. Radon is this naturally occurring invisible gas that is underground and it gets released. And some homes have levels of radon that can get them sick. So there are testing kits that you can get right at your local Home Depot or Lowe's, and it's a really easy test, and you could find out, one, if your radon levels are high, and if they are, there's some pretty simple mitigation that can be done to your house to vent that radon gas out. And then sort of the last piece is air pollution. We know that long-term exposure to air pollution can be a risk factor for lung cancer. So if you or someone, either through work or through your own activities, are exposed to high levels of air pollution, you should try to do what you can to mitigate that risk, perhaps working out indoors if that's something you do, or if it's a work-related exposure, making sure that you're using all OSHA protections, things like masks, to prevent the breathing in of that pollutant. Nicole, I think I interrupted you. I'm sorry.
No. I was saying you can get the radon kits at Home Depot, which after my sister was diagnosed, my whole family did that.
So, Nicole, was your sister Jeanine exposed to smoke secondhand, or was she a smoker at all?
She never smoked. She was not really exposed to secondhand smoke. We really don't have an answer to why she got lung cancer. We don't know.
So tell us, Nicole, how did you become involved in the American Lung Association?
Well, initially I got involved through my sister. She got involved in 2015. She formed our team Jeanine, and she spoke at the very first Lung Force Walk in New York City. And when she passed, I just continued to keep our team going and stay involved.
So what advice do you have for families who are living out there, may have a loved one that has lung cancer? What advice would you give them?
Well, first and foremost, keep fighting and just spend time with the people that you love and make lots of memories. Memories last forever.
I think that you're doing an excellent job with that, Nicole. Michael, tell us about the Lung Force Walk. Is this an annual event? And tell me about it.
Yeah, so we have an annual event, multiple events in the metro area now for our Lung Force walks. And these are, walks that are really inspiring. We get to, walk with survivors and other Lung Force heroes, where you see a sea of turquoise. And, as Nicole mentioned, her sister spoke at our first walk down in Lower Manhattan, and Team Jeanine has been, one of the top fundraisers across all these events. And this year, for the first time, we launched the Lung Force Walk Long Island. And so last month in October, we had the Lung Force Walk in Eisenhower Park, and it was a rainy day. It was it was probably the rainiest day of the entire fall, but it didn't slow anybody down. I was amazed. I drove into that event thinking, a lot of people were going to stay home because it was like a monsoon out there, and you saw smiling faces, and you saw everyone coming together to raise awareness and walk with each other. And that's exactly what we did. And by the end, the rain had stopped, and it felt like, that somebody was looking down at us. So it was an inspirational day, as they always are, because these are events where, people that are currently fighting lung cancer or have survived lung cancer are there, or, in Nicole's case, she's walking in the memory of her sister. And so, I too have had loss from lung cancer, and I just find the Lung Force Walk such a powerful event and really inspiring and uplifting. And it keeps me going year after year to do the work I do, being inspired by all those that join us.
So, Nicole, I know that you loved your sister Jeanine, but I'm going to tell you, I love her name. And that's probably because we have the same name.
I know. I love it.
If you notice that. Oh, so I know the big thing with the association is talking about quitting smoking. What is the latest effort in this area? Just to quit smoking. Is there something that is cutting edge with how to quit for those individuals who want to?
Jeanine, I'll take that one. Nicole is a fantastic volunteer, but she focuses her efforts on the memory of her sister. And so, there are many tools available to people who want to quit, and we encourage folks to visit our website at lung.org. And come up with a quit plan. A lot of people think about sort of milestones and times to quit. So, a big time to quit is right around now, during the new year. To start smoke free in 2024 is a great resolution, and we know that quitting smoking is very difficult. Most people take 5, 6, 7 attempts before they're successful. But each of those quit attempts give you lessons learned into what to do next time. So, we strongly encourage having those conversations with your loved ones and coming up with a plan. And lung.org could help walk you through exactly how to do that and how to be successful this time.
So this is for both of you. I know that any inhalated substance can pose a threat to the lungs. What about vaping? Is this a similar concern?
So vaping definitely is a concern for us. It has differing health aspects, as you know. So the combustion, burning products and breathing them in presents certain health problems. Vaping, which is much newer, we know that there are health problems. You may remember back before COVID came around that there was what was called the E-Valley crisis, where people were, especially young people, were going to the hospital because of the products they were vaping. So we consider all tobacco use problematic. We know there are health effects, and we also know that switching isn't quitting. So there are tools available to quit your tobacco addiction once and for all, and we want to help you do that. Switching, we haven't seen any data that shows that is successful. There are FDA-approved various tools like the patch, gum. There's even medications that can help. And so talking to your healthcare provider about what might be best for you and make this quit attempt the one that is successful is definitely what we want to help do. Quit all tobacco use, including vaping.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today you're learning about lung cancer, the leading cause of cancer deaths on Long Island and throughout the United States. My guest today is Michael Seilback, the National Assistant Vice President of the State Public Policy for the American Lung Association, and Nicole Sturiano, a resident of Ridge here on Long Island, who lost her sister Jeanine to lung cancer at 42 years old. How significant is this amongst young adults versus the older adult? Are we seeing lung cancer across the lifespan, or is it more with the older adult?
Yeah, so generally, lung cancer is diagnosed at a more advanced age. Clearly, in the last couple of decades, we've seen the average age actually decrease a little bit, and that's because as smoking rates have decreased, we're seeing less of those long-term smokers. But what it is exposing are stories like Jeanine's for people that have unknown exposures or perhaps no exposures. But obviously that's going to bring down the average age. So, generally, we see lung cancer diagnosis. I've seen it as young as teenagers, but really for the most part, you're talking about mid-30s and upwards. And then again, if you are somebody that has, long-term smoking and between the ages of 55 and 80, you're someone who might be eligible for screening. And so we want to decrease those numbers as we decrease tobacco use.
So I'm looking at air pollution that you mentioned earlier. What is unhealthy air quality? Are we looking at suburban communities versus urban communities or rural communities? Have they done this kind of differential research to say that people who live in more of an urban area is more likely to be exposed to air pollutants?
Yeah, it's a great question. So the carcinogen that we think of when we're talking about air pollution is what's called particulate matter. These are minuscule particles, smaller than the diameter of one human hair. So these are tiny, but you see those particles in things like diesel exhaust. So, big trucks that are not electric, that big black puff of smoke has particulate matter in it. But it's not just things like that. It could also be home heating oil, especially, the older, dirtier forms of heating oil that we've been moving away from. And then the sort of the opposite part of your question, it's the combustion of wood is another place where particulate matter is created. So we really see it as both a urban, rural, and suburban problem, depending on what that source is. But we know that if you're someone who lives, next to something like the BQE, where there is, heavy truck traffic, or down in Hunts Point, they've made a major effort to decrease the amount of heavy polluting vehicles, but we still have a long way to go. So if you're someone, if you're even on the Long Island Expressway, if you see the plumes of smoke, you're unlikely to have any issue just, driving on the LIE, even daily. That's not what we're talking about. But if you're somebody who works outside or lives, immediately next to a bus depot, you might be exposed to higher levels. And then again, if you're in a more rural area where wood burning is common, that's a place where we see exposure as well.
So how does one get involved with the American Lung Association? How can we give donations? How can we become a part of this great thing?
Well, thanks so much for asking. And, there are two really easy ways to do it. The first is visiting us at lung.org. lung.org, and that's our website, which obviously has all the information as well as ways to get involved. If you're someone who is more used to using your phone, you can call 1-800-LUNG-USA and be connected to your local lung association and find out about all the great events that we have in your community.
How about Nicole? How can
Yes.
we, as individuals who may be family members, how can we give back? I know you give back in many ways. Any other ways?
Get involved. Like Michael said, get on the website. You can form a team and come and support the American Lung Association at one of the Lung Force walks. They're everywhere. They're not just here on Long Island in New York City. There's literally a Lung Force walk all across America at different times of the year. But get involved. The more people involved, the more awareness we're going to have, the more research can be done, more funds are raised.
I think the bottom line is get involved, become educated, and
Just
do
get
what you
involved.
can do to prevent this from happening to you. So we want to thank you for being here, Michael Seilback, the National Assistant Vice President of the State Public Policy for American Lung Association, and Nicole Sturiano, a resident of Ridge here in Long Island, who lost her sister Jeanine to lung cancer at 42 years old. We thank you for giving us all the important information today, and good luck with all that you're doing, all the great, wonderful work for this organization.
Thank you.
Much,
You too.
Jeanine.
You are very welcome. This is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the Nursing Department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.